This morning, I'd like to give you a bit of an update on how we are adapting our contact tracing processes in the environment of the case numbers we're currently seeing. As everyone is aware, we plan and we strategise and we innovate to ensure that we manage the public health risk based on our case numbers that we are seeing at any one time. Our system, which has been planned for, has been remarkably resilient over the past 12 months against the pressure of rising case numbers and has successfully driven Delta outbreaks down and Kappa outbreaks down, although of course at the moment we are no longer aiming for COVID zero in accordance with both the national plan and the Victoria's plan to get fully vaccinated at this point in time. In our most recent daily operational report, still 99.7% of confirmed cases were contacted within 24 hours and 97.8% of primary close contacts were contacted within 48 hours, and we continue to exceed the national benchmarks. Our contact tracing teams and the systems that support them are always adapting and changing to ensure that we focus on the greatest public health risk. And we have to focus on the actions of highest value, being ensuring people are aware they're positive and knowing it quickly, connecting them to the support they need, and identifying those who may present a higher risk due to the nature of their work or the nature of the people they mix with. We will always contact people to provide them the support they need. That will never change. If people need medical care, medications, support with groceries or food or income support, we are here to help. So we're always considering a number of scenarios and planning in accordance with the projections from the Burnett Institute and working through processes that are standardised and scalable and automated using technology as much as we can. These approaches might be applied a little bit differently based on our local public health units and again the public health risk. So regional Victorians and those in Latrobe may be seeing something different at the moment to those in, say, the north of Melbourne. In areas with higher case numbers, we have started providing a text message with the confirmation of your confirmed positive result, so we can provide triage and ensure we address with a phone call the highest risk cases. That triage form in that text message asks a number of questions to help us with that prioritisation. It will ask if anyone at home is being looked after by that confirmed case, such as children or someone with a disability. It will ask if that person needs support to help isolate at home, such as groceries, medication or income. It will ask if they are vaccinated and will confirm that against our own records, and ask if there's been any exposures to high-risk settings, such as hospital, aged care, childcare, or at the moment anywhere in regional Victoria as we try to protect regional Victoria, as we have done in recent days with Latrobe. The shorter phone interview will then be prioritised based on those results, but everyone will still be getting a phone call. We'll continue to manage close contacts as we have been, but at the moment, the initial interview is more of a household interview rather than perhaps where we were a couple of months ago, being able to interview every single primary close contact. And of course, we'll always continue to manage our sensitive settings, such as hospitals, schools, childcare, and so on. It's clear that we would never have the same result or intensive approach to somewhere like a disability or aged care setting than we would to, say, a landscape gardening business. The risk is different, and helping to protect Victoria is what this system is all about, and preventing illness and preventing death. Should case numbers increase further, although it's all in our collective will and efforts to try and maintain them, we will adapt the approach again and again and refine it based on risk. The goal of our approach, and through this planning and through the enhancement of our systems, is to manage the settings that might result in the highest number of transmission, and will continue to refine over time. So like I said, at the moment we're taking a different approach in the north and west of Melbourne than we would in Warrnambool or Latrobe or Baw Baw, and we'll scale up and down as necessary. I'm extraordinarily proud of the work of my team the work of the public health units, the work of our partners across community health, the health services, and across government. We continue to adapt. We continue to innovate. The teams continue to address every challenge that is thrown at them, and I'd like to thank them. So, thank you. If you're helping with this COVID response, you're helping with our local public health units, your work is extremely appreciated and valued. Victoria asks a lot of you, and you continue to rise to that challenge, and we'll continue to protect Victorians as we increase our rates of vaccination and get to the other side of this challenge.